Hey everybody, what's up? Devin here. Today is December 30th, 2016, and I am a week post-op from having my third revision with Dr. Garamoni in La Crosse, Wisconsin. For those of you who don't know, I originally had my first top surgery with Dr. Benacci down in La Crosse, January 15th, 2013, so I am about 15 days from being 3 years post-op overall, and I've had 3 revisions. I have been on and off T with 2 of those years in between. So I'm finally back on T. I'm about 4 months now, and things are going great. But I had some extra skin that we had to work through to do some cosmetic changes. But the first 2 were definitely required. There was, damn, that one actually looks good. There was 40 cc's or grams of tissue that had to be removed. And at a different time, there was 80 cc's of fluid that was building up in a pocket that was going to cause an infection. So that was actually the first revision that we had to do. And we had to clear that out before we removed the 40 grams of the tissue, just to make sure it would heal up okay and we wouldn't have another pocket, cause an infection, even more time off. So then this was the third revision that I had. But basically, I wanted to narrow out my areolas because they were ginormous in my opinion. Like I've always told them, I need smaller nipples. I need smaller nipples. Well, yeah, when you tell a doctor that you need smaller nipples, he's gonna look at your nipple, just the nipple, not the areola, the nipple. He's gonna trim them down for you. Sweet, awesome. I do what you said. I trim down the nipple. Okay, so there was some terminology error. I totally meant areola. I want a smaller areola. Okay, so we finally had that talked about. That was going through, laying on the surgery table for my third revision here, and we had to have the final talk about, okay, so how big does Devin not want his nipples? Well, I'm used to working in inches, so I was like, I don't know, about 5/8 to 3/4 of an inch. And so he came back at me in centimeters, and I'm like, it's like 10 o'clock in the morning, and I definitely don't do that type of math right now. I know it's like 2.5 is an inch, but I'm so not good at math right now, and I'm stressing out because you're talking about nipple size, and I'm panicking. So he converted for me, and the awesome nurse lady that was there, but that was a nurse technician. Sorry, Ruth. Her and Caroline actually took the little measuring tape. I don't know, it was a little stick or whatever that had the conversion of inches and centimeters, and like literally put it on my nipple. And I was like, yep, I more or less want 2.5 to 3. Unfortunately, when you get that small, because my nipple itself is about a centimeter, so he'd have a 1/2 centimeter on each side or 3/4 of a centimeter on each side, I think, something like that. And that's just kind of really hard to do, especially if you don't want the nipple to be pulled or stretched, disformed in any way, which is why we're having the surgery, to fix the distortion of my nipples. So when we were there, we finally agreed on fail-safe. Yes, he doesn't want to go lower than 3.5. I would much rather stay closer to 3. So he's trying to do what he did, and hopefully we came out with closer to 3, but I told him I don't want him to potentially distort my nipples or risk that, because that is definitely why we came in. And so we will see. I haven't taken off the bandages because Nurse Debbie told me to leave them on there for 2 weeks or until they fall off. I've been playing with one over here. It kind of wants to go, but then I saw the suture and it's not ready yet, so I'm going to leave it there. But I'm trying to be patient because I really don't know how big my areolas are right now. And that's probably the most exciting and nerve-wracking thing that I can think of right now compared to anything that I've been going through recently with my transition. I mean, besides getting back on testosterone, like I've been post-op top surgery for 3 years. I really didn't think my chest was going to change very much. I'm really excited to have smaller nipples because the bigger ones were annoying, disc-shaped, and I was not happy. But the fact that he was able to go in and do some work and tighten it up, I feel much more confident about my chest, and I haven't even seen my nipples, but I still want to see my nipples. Anyhow. Oh, he's also fixed some dog earring over the years, just minimal cosmetic stuff. This was the only purely cosmetic surgery that he has done. Unless you don't count the first surgery as being purely cosmetic. Technically, I'm transgender. I don't know which way you want to see that. Make up your own mind. Either way, in my opinion, this is the only one that I've had that's purely cosmetic. The first one needed to be done or else I would not be here. Yeah, no, it's not going to happen. Not that I'm encouraging suicide in any way, shape, or form, but I knew for me, if I had to go past 25 without being semi on the path of being a dude, there's no way I'm going to be able to survive the rest of my life living in this body as female with double D's. If you want to be a dude, I really don't think that anyone would want to have the biggest tits known to man. Okay, not 100% known to man, but you know what I'm talking about. Like, they're ginormous. No, thank you. I wore 3 binders for a reason. Don't do that, by the way, either. It's not good for you. Anyhow. Alright, so the difference when we were talking about the size and the areolas, that's a 1/4 inch difference from me wanting to stay at 3 to 3.5, between 4.5 to 5 centimeters, which is what it currently was. Like, so he took off a 1/4 inch on each side? On one side. It's an 1/8 inch on each side, I believe. Because they were my first overall width after the first surgery. So going into surgery, my nipples were at a width of 5 centimeters. And my areola was. My nipple is a centimeter by itself. And so I basically had 2 centimeters on each side of the nipple. That was my nipple. That was my total areola. Stupid terminology. Yeah, so that's just way too humongo. So I told him to try to get down to 3. So we're going to see what it's like. I am really obsessive over the nipple right about now. Not even going to lie. But anyhow, so this was my 3rd revision from Dr. Benacci after being 3 years post-op of my first top surgery. I don't know. It's healing great. This surgery with the revision, this is the least amount of pain I've been with any of my surgeries. I'm very impressed because I was terrified going back in there after my last revision because that one was painful. And the 3 days afterwards were killer. I'm not even on the painkillers anymore. Nope, I don't need them. It doesn't hurt that bad. I don't know if it's because I lost weight and so there's less fatty tissue that needs to be messed with or removed or whatever, but thank God. That's a relief because I was panicking laying on the surgeon's table, just be like, it's gonna hurt, this is gonna hurt, this is gonna hurt, and I didn't feel it. I'm sorry. So for those of you who don't know, with these revisions with Dr. Benacci, all the ones that you have after your first initial surgery where you're under, you have to stay awake for because they're using a topical anesthetic that they inject into where they're messing with you so that you can communicate if you feel any pain or burning sensation from where they cauterize. It's not necessarily the most fun. The first 2 were pretty bad. I mean, the first revision I had wasn't that bad. Yeah, I felt him cut me and I felt him burn me a few times. It's not fun. But it wasn't intentional either. He doesn't know that I'm going to feel it until, oh, well, I guess the anesthesia didn't quite work right there. So he's going to, inject some more, hopefully you numb up, and we'll proceed. That's the way he does it. The second surgery was the same kind of story. He didn't necessarily know where I was numb until he was messing around, and it was just more painful. I think it's because we had to, we were fixing some dog earring, and we had to readjust the placement a little bit because I think the left one was a little bit far off. Either way, there was a tad bit more work that he had to do for my body compositionally to look better. So it just went through a lot more. I would definitely say that this is my least invasive surgery that I've had with him. Thank God. And hopefully it's my last. And it's definitely been most pleasurable. I can't say more. I'm very happy that I was able to get in with Dr. Garamoni. Ooh. I did not go to Garamoni. I went to Benacci in La Crosse, not in Florida. That was bad. But, shoot, no, that's where I was going. I hope I don't have to have any more revisions. I hope that this passes me off like a stone gem and I'm fantastic. But I couldn't have asked for more. I was lucky enough to be able to get in before New Year's, but after Christmas, no, technically I was wrong. Technically I was in 2 days before Christmas. But either way, I was able to use some vacation time in order to mess around with it with work so that I didn't have to take off too many days, lose a bunch of hours. Everything was really smooth. It really worked out very well for me. I'll keep you guys updated with chest surgery and testosterone. Until then, I'll see you guys next time.